Ever wonder what actually happens when your dentist tells you that you need a crown? In this video, I'm gonna walk you through it step by step from what happens when your dentist takes that x-ray to when you get that crown cemented in your mouth. Also, I might point out a couple surprises your dentist doesn't always tell you. By the end of the video, you're gonna know what to expect and what to ask when getting a dental crown, so make sure you stick around till the end. Hey guys, my name is Dr. Amanpreet Singh. I do crowns almost every single day in my office, and usually a crown discussion is triggered from one of a few things. Either you have a giant filling that cracked, or you have a huge cavity in your tooth, or your tooth had a root canal. So this can start one of two ways. Either you come in as an emergency saying, hey doc, my tooth broke, I was chewing on a beer bottle or something like that. Or you could be in the hygiene chair getting your teeth cleaned, and then the dentist comes in and then looks at your teeth. And usually we will take a couple x-rays and then we will diagnose the problem. At this point, the tooth might or might not be hurting you. For example, if there's a giant filling in your tooth and you're getting a cavity underneath it, you might not even have any pain and might not realize it, but that's why we diagnose it to prevent you from feeling any pain in the first place. Or you could have that cavity really big and enter the nerve inside of your tooth. In this case, you might need what's called a root canal. A root canal is when we go in, clean out that cavity, and then also clean out the nerve inside of the tooth, and then afterwards, you would need a crown to protect it. But either way, I kind of want to give you a gist of the different things that could be going on as to why you might need a crown in your tooth. But usually the dentist will kind of go over this. They will take the x-rays, they'll take pictures, and they'll show you everything so that you can understand exactly what's going on with your tooth. Now, with that being said, how many visits is the actual crown procedure and how long does it take? So it's usually done over 2 visits. It might be done all in one visit. I'm gonna get to that in a bit. And usually over these 2 visits, it can be done in around 1 or 2 weeks. And if it's done over 2 visits, usually the first visit might take like an hour to like an hour and a half. And the second visit's usually pretty quick. Could be like 30 minutes to 45 minutes. Now, obviously this timing all varies depending on the actual dentist that you're going to. Now, in terms of the cost, this really depends on a couple things, like which office you're going to, where you're located, and also your insurance. So if you're worried about that, make sure you talk to the front desk or whoever's managing all their billing beforehand so you're not hit with any surprises later on. Okay, so let's get into the first visit. What exactly happens when you need a crown? So first thing they'll have to do is numb the tooth. So they'll use local anesthetic. This is usually done with lidocaine, but there are other types of anesthetic out there. Another common one that we use is septocaine. This numbing usually lasts for a few hours, and depending on where you need this crown, you could have a whole bunch of your face being numb or just a little part of your face being numb. Usually on the top teeth, especially in the back, it's more local, like you don't really feel like your whole face is numb. But on a lower back tooth, that's when usually a lot of your jaw is gonna be numb. Now, after the dentist does the numbing and while you're getting numb, usually their assistant will come in and pick a shade. That's where they'll come with this wheel or this tray of different colored teeth on there, all with different shades. And the whole goal is when we deliver that crown, we want it to blend in and look just like all your other teeth. So the assistant might spend a minute or two kind of picking different shades and finding just the right one. And sometimes we might even blend multiple shades together because teeth usually aren't just one uniform color. Typically, they're darker right along the gum line, and then as they get more towards the biting surface, they get brighter or whiter. So especially for front teeth, a lot of times we'll pick multiple shades. Now, after we get that all ready, now it's time for the preparation. So the whole purpose of a crown is kind of like a helmet that covers the tooth. So in order to make room for that helmet, you have to basically shrink that tooth to a smaller version of itself. So this is where like 360 degrees around the tooth, we will have to shave off like 1 to 2 millimeters. And the whole goal is to create a uniform layer, but also enough thickness for the crown. Now this part is super important because you don't want to reduce too much of the tooth structure because now you're compromising the strength of that tooth. That tooth might get too weak. But also you want to make sure you reduce enough tooth structure so you have enough thickness for the crown, because if the crown itself is too thin, then the crown can break. This is why dentists spend years training on models first before they ever see a patient so they can get this part right. Now during this part, we might also do what's called a core buildup. A core buildup is basically just a filling, but a filling that goes underneath the crown. Now this is done if you had like an old filling that needed to be removed, or if you have a cavity that needs to be removed. So both of these will involve like a hole being inside of that tooth. Even if you shave 360 degrees around that tooth, you're still gonna have a hole inside of that. So I kind of drew a diagram here to help you understand. So let's say you start off with a tooth, it has a giant cavity in it. I didn't draw the cavity, but then you prep it for the crown. So like I said, a crown is a smaller version of the tooth itself. If you reduce like 2 millimeters from the bite, 1 millimeter pretty much all the way around it, and then you still have this hole or this cavity inside of that tooth. That's where that core is going to come into place, so that when you put the crown on it, you don't have this hollow structure or this giant hole when you remove that cavity underneath it. So this blue part here is basically the core, or the filling that goes underneath the crown. I labeled it the core buildup. Now I'm going to go on the other side. Before we go to the final step, I want to talk about what happens after we do this core and after everything is done with the preparation. So once we get to the core, now we need to take an impression or a scan of this tooth. This is how we tell the lab exactly how to design this crown. So in my office, we use what's called a scanner. It's basically this digital wand that takes a bunch of pictures every single second. And nowadays we can use this instead of taking a physical impression. But back in the day, what they used to do is they used to put this gooey stuff around the tooth and then put this tray over the tooth, and that would kind of capture what that tooth looks like. And then you would send that impression to the lab, and they would pour it up and then make a mold of it. And that way they have something kind of replicating what it looks like in the patient's mouth. And then they would use that and design a crown on that model. Now with the scanner, it's essentially the same thing, but now we just take a wand, take a bunch of pictures of it, digitally send it to the lab, and then the lab can do the same thing. They can print it out, and then they can use whatever that scanner shows to make a crown according to that. And then they ship it back to our office. And this is where the second visit comes into play. Now, I know I mentioned that sometimes you can do a crown in one visit. This is if a dentist has all this technology in their own office. So let's say they have that scanner and they scan this crown. Instead of sending it to the lab, they can print that crown in their own office. That way the patient just waits a little bit, reads a newspaper or something, and then after like 20, 30 minutes, then when the crown is printed, they can deliver it right that same day. Now, the only caveat with this is the technology still has to improve a little bit. And the main reason for this is the materials that we have to use for these same-day crowns aren't as strong as what we can get from a lab. So if a tooth needs a lot of forces, like a lot of chewing forces, like a back tooth, like a molar, you might not want to do this. And your dentist might not feel comfortable doing this either. So for those cases, usually it still needs to be 2 visits. But for a front tooth, where it doesn't really require that much chewing and you need it to be more aesthetic, this is definitely possible to be done in 1 day as long as the dentist has all the right equipment. Now, if your dentist doesn't have the right equipment, don't go blaming him because this stuff is really expensive. But let's assume that your dentist is doing it the way that most dentists are doing it. We're doing it in 2 visits. So at this visit, before we get to the final visit, we need something to cover this tooth. And this is where you make a temporary crown. Now let's go back to step 1. I'm going to turn around. Step 1, we will usually take an impression of this crown, what the initial tooth looks like, and we will use that impression to make this temporary crown. Now the temporary crown material is a lot weaker than the actual permanent crown material, but it's mainly something just to cover this tooth so that this tooth is protected until we can get that final crown there. So after that scan or that impression is done, then the assistant will usually come in, sometimes the dentist will do it, but they will come in and they will design the temporary crown and they will cement it with a temporary cement. Now with this temporary, you want to be really careful with it. You don't want to eat anything super chewy or sticky, something that can pop it off, or anything too hard because the temporary crown is weaker and it's also easier to pop off. Now in between this visit and this visit, this crown is being designed in the lab. So typically the lab will start with like a block of either zirconia or a ceramic. It really depends on what material the dentist chooses. And if we're doing a scan and send that scan to the lab will use a special software to design the crown on their computer. And this is really cool because on the software you can look at the margins of everything. You can look at like how the crown is touching the neighboring teeth. You can look at how they are biting on that crown. Once the lab technician thinks they get all of this right, then they will print the crown. So after this is printed, it's still not done yet. So for example, if it's a zirconia crown, this is the most common material that we use for crowns. Right after it's milled, now it has to go into an oven. This is called sintering. After it's done being in the oven, now the crown is ready. It's really hard, but there's still a couple more steps that the lab does. Now is where the technicians start to use their art. Sometimes they'll do some like staining on the crown because like I said, your teeth aren't just one color. So they want to make it look more natural. So instead of making it look like one chalky color, like a stick of gum, now they're going to start to add texture and staining to it. And then lastly, they will do some glazing. This is basically adding like a shiny coating to it. And then again, it's put in the oven and this will make the final crown look really nice and shiny. Once they do all their final checks and it's ready to go, they will send the crown back to the dentist. Now, depending on the lab, this process could take like 1 to 2 weeks, sometimes even longer. But this brings us to the final step. So when we're at the final step, like I said, we have to remove that temporary crown and then clean off all the excess cement. Sometimes your tooth can be really sensitive at this point. It really just depends on the person. So once in a while, you might have to be numb for this procedure to get that permanent crown. But usually you will not have to be numb. But then once the temporary crown is off and the tooth is ready to get the permanent crown, then we try in the permanent crown. And this is where the dentist does all their checks. The first thing they'll check is the contacts with the other teeth. If the crown is too tight, then the dentist might have to adjust it. If it's too loose, then they might have to send it back to the lab to get adjusted. Hopefully that doesn't happen. They'll usually check it with floss. So like let's say it's a crown in between your teeth, then they'll floss in between the teeth and see if they have like a nice contact. If you hear like a nice snap and that floss isn't shredding, like it's not too tight, then it's a perfect contact. And the dentist will also check the margins. So where the crown meets the actual margins of your tooth, they'll probably take their Explorer and kind of feel around and check it. They might even take an x-ray just to make sure they don't see anything funky on the x-ray. And then after this, they'll check your bite because they want to make sure you're not biting too hard, but also not too soft on this crown. So if you're biting on this crown, they'll probably make you check with a piece of paper they'll have you bite on, which will kind of mark the crown. And if it looks like you're hitting too high, or if it feels to you like you're hitting too high, then they might have to adjust it again. Once all this is done, they also have to make sure that you like it. So they might have you look in the mirror, make sure you like the shade, and they might also check the shade themselves. If the shade is off, they might have to send it back to the lab and then get something adjusted. Like sometimes if the crown is too white, you can send it back to the lab to get it darker. But usually if it's too dark, you have to remake the whole crown to get it to a lighter shade. So you can see there's a lot of checks that go before we put this crown in the tooth. But once all the checks are done, now the crown is ready to be cemented. So then they'll put this thing to clean off the inside of the crown. They'll get your tooth ready. They want the tooth to be super dry. And then they'll put the cement and then cement the crown on. And then depending on the material, this might take like a few minutes, might take 5 minutes. Sometimes they have to shine the light on the crown in order to fully harden it. But they also want to make sure they clean off all the excess. So sometimes when you put the crown on, that extra cement kind of leaks out of the crown. And then the dentist is going to make sure that they clean off all of the extra cement before you go home. So that is the final crown appointment. Now, what can you expect after this? Well, once you get to this point, you can pretty much treat it like a normal tooth, but I would be careful on it for the first day or two because the tooth can still be sensitive because you did so much work to it and the tooth might be healing from that. The gums might be sensitive because the dentist had to clean off the extra cement. They had to take off the temporary crown. So it had a lot going on with it. Regardless, I think you should avoid really sticky foods like things like Laffy Taffies or Jolly Ranchers because those things can still pull off a permanent crown even with permanent cement. And regardless, you want to make sure you're brushing and flossing this final crown like a normal tooth because you want to make sure you keep it clean. And that way you will also keep the gums clean around the crown. And if you have clean gums and a clean crown, then your mouth will thank you. Now, a couple questions I commonly get. Does this procedure hurt? Usually no, because you are going to be totally numb. If you do have any discomfort, it might be after the procedure is done, and that just depends on your pain tolerance and then how your tooth responds. Once in a while, the tooth might be sensitive, but usually people are totally fine after. And then after you go home, if it feels like the bite is off, like it felt good in the chair, but when you start chewing foods, like it starts to hurt when you bite, or it feels like the bite's too high, you definitely want to go back in right away and get that fixed because it can be as simple as just a simple bite adjustment, and then that pain can completely go away. Anyway, thank you guys for watching. I hope you liked that video, and I hope this helped if you need a crown or if you're planning on getting one soon. And if you haven't already, make sure you hit that thumbs up button and subscribe to my channel below. I will see you in the next video. Did you know that what you eat can be affecting the health of your gums even more than your toothbrush? A new study suggests that what you're eating, especially if it resembles a Mediterranean diet, can help lower gum disease. But is that actually true? This can be a big deal since gum disease isn't just about the health of your mouth. It's also linked with other systemic diseases like heart disease,